Do not appoint any physician as Health Minister, Union urges Tinubu. Welcome to the news, and please subscribe to our channel to get notified when we post hot juicy news updates. Please click on the notification bell. The Joint Health Sector Union and Assembly of Healthcare Professional Association have called on the President-elect Bola Tinubu not to assign the portfolio of Minister of Health to a physician. The Health Union, in a statement signed by its acting National Secretary Matthew Ajorotu, said the nation's health sector has been progressively destroyed in the last 3 dispensations of leadership with regards to ministerial appointment. The union said, and I quote, "Today, the health system in Nigeria, which is rated 187th out of 191 by the World Health Organization through the mechanization of the leadership of physicians, stand no chance of redemption except the president-elect comes up with a unique model of reforms which places a premium on change agents who are not necessarily health workers to redress the ills in the health sector as presently nurtured by physicians at the ministerial parastatals and other agencies of the Federal Ministry of Health." At the height of ministerial nomination and screenings in the country, Nigerian physicians have always taken parochial positions that one of its own must be appointed to the helm of the Federal Ministry of Health because, according to it, this was global practice. Section 1471 and 2 of the Constitution of the Federal Republic of Nigeria, 1999, is very clear as to how ministers are appointed. Section 42(1)(a) and (b) also compels a right to freedom from discrimination on the basis of ethnic group, place of origin, sex, religion, political opinion, as it prohibits all of these in its entirety. A minister of the Federal Republic of Nigeria is a political appointee whose duty is purely administrative. According to Ajorotu, the general perception on why physicians want to continue to be Minister of Health is to maintain the hegemony of the unjust entry level in the civil service. Discriminatory salary scales and continue to intimidate the Nigerian public with a frequent and selfish strike action. So, I don't understand. I thought you don't bring people who don't know the onus about the job. Don't know anything about, who do not know the onions. I thought, let's say, for instance, for the Minister of, let's say, Finance now, you put in somebody who, the person now waiting in do, the person apart from waiting be saying do, and work, as in, you don't get experience when it comes to the person's personal work, maybe private work, maybe career. Now, the line with the person too. So them coming out to say it's not working for them, I don't now know what is going to work. You want me to carry carpenter put for that place? Because I am not really understanding what these people are saying. 1999 to date, no Minister of Health made significant contribution to Nigeria's health sector, like former MOH Eyitayo Lambo, 2003 to 2007. And true to this report from the Health Union, Eyitayo wasn't even a medical doctor, the only economics ever appointed in that capacity. Even the highly rated former UIVC in Isaac Adewale wasn't too inspiring. No clear-cut policy targeting reforms in the health sector since 2007. At least we can trace health sector reform program, NHIS, to Eyitayo Lambo. And nothing the core medical professional did not see or do to frustrate the man back then in 2003 to 2007. Yet, they haven't fared better in that role. So, the thing is, people are coming out to say, okay, if they're not going to put person will be physician, who they will come put? Obstetrician, gynecologist, what's it called? Chief surgeon or surgeon, because I don't understand. PhD in nursing would do well for the post. They should consider it. My dear, the thing is, there's actually a different thing in you being very, very good at your job and you managing that particular sector. I don't know if you know what I mean. Maybe they are good in their jobs, but I've not really found somebody who will actually manage these things, come out with ideas. I don't know if you know where I'm going to. Good. Someone like, let's say, they have in the hospital, they have an admin, but the person still gets to do with something to do with sciences. I say sciences and medicine. Do you understand? The person is an admin officer in the hospital, but his own admin is not general admin. He also, is towing that line of medicine. I don't know, but at the end of the day, I know that doing your job very well and also, be able to run that position, they're two different things. They don't even believe in our health sector because they and their loved ones travel out of a treatment. I would say anybody that comes in should sign it into law. You and your loved ones are going to be treated in the country. So if you like, bring out reforms, so we say go better the common man. You too, this fly out anywhere. Now here you go there. By the time where do and well, anything we do, you go do you well. Will affect you well. Is it that only P2B that contested after they came? No, we're not talking about P2B here. We're talking about the health expert. Okay, he will only rule Agboro in Lagos. Oh my goodness. Tinubu that is receiving treatment in another country. Do you think they care about what happens here? If they care, they would have built better hospitals and equipped them and receive whatever treatment they need here. My dear, they want avenue of where they will continue to make money, spend money. London Medical Services is his own concern. So this is actually good advice. If they like, then take the advice well. If they don't like, then shall don't give them the advice. Okay. On this note, we have come to the end of the news. We say thank you for turning to listen. Until I come your way next time, enjoy the rest of your day.